I think there are many challenges, and it's hard to say which one's the biggest. That's different at different points along the way. I think we're making a lot of progress with a range of points of governance, a range of points of trust, identity, and breaking down some of the siloed data barriers that have held us back. I think that the one that's just been discussed on the main stage is public procurement. And that as we're working with individual partners, individual enthusiasts, and we establish those connections as clinical teams, then to take that next step and to get that recurring resource in place for that requires a procurement exercise, and how to navigate the law in that space is I think a challenge still to be tackled. There's lots of enthusiasm. There's lots of people talking about the challenges, also the successes. There's more than just hype. There's hope and delivery and evidence and experience. So I think it's bringing together all of that. That each connection that's made is another potential, direction that is going to help something kick on, or just seeing how someone has tackled one or overcome one challenge, that's going to go back to another place, another space. It's about saving lives, and that's what drawing the experiences from these meetings helps us get closer to. Fast and far is I think the summary. I think we're really at a tipping point, and diagnostics, whether it's imaging, whether it's pathology, skin or retinal photography, physiology, the ability of the technology to assist clinicians, support clinicians, provide them with more headspace and more time. All the evidence is there. I think it's going to be the next steps that come beyond that. What are the additional insights, that layer of additional information that's going to shorten the lead time to diagnosis, that's going to reduce the unscheduled care presentation, that's going to help us shift things back more towards elective care. I think diagnostics can be, if you like, the engine room for the transformation of NHS and other healthcare systems. I'm Chris Carlin. I'm a respiratory physician and Professor of Respiratory Innovation in the West of Scotland. I've been in respiratory clinical practice for over 20 years and involved initially in clinical research, but then progressed into innovation, and one of the founding principal investigators of our West of Scotland Innovation Hub.